Greetings, everyone. I'm thrilled to have you join us here at ERMP and beyond. In today's session, we're diving into a topic that's crucial for medical professionals and students alike, the implications of splenectomy. This is a subject that often pops up in medical exams, and for good reason, so let's not waste a moment and get right to the heart of the matter. Prepare to enrich your knowledge as we unravel the complexities of post-splenectomy care together. A 26-year-old female known immune thrombocytopenia patient taking maximum dose of prednisolone became refractory to medical management. The managing team decided to do splenectomy. What is recommended before the splenectomy? A. Bone marrow irradiation. B. Pneumococcal vaccine. C. Washed leukocyte. D. Platelet transfusion. Welcome back. What are the most frequently asked exam questions in post-splenectomy care? Imagine a world invisible to the naked eye, where bacteria like Streptococcus pneumoniae, Haemophilus influenza, and Neisseria meningitidis lurk, waiting to pounce on the unsuspecting. For patients without a spleen, this world poses a significant threat. These encapsulated bacteria can cause severe deadly infections such as meningitis, which is why understanding the risks and preventive measures is paramount. Vaccinations are the shields in our arsenal against these microscopic invaders. For asplenic patients, vaccines against pneumococcus, Haemophilus influenza type B, and meningococcus are not just recommended, they are a must. And let's not forget the annual flu shot. It's a simple yet effective way to keep the flu at bay. But what happens when prevention isn't enough? This is where prophylactic antibiotics come into play. Medications like penicillin can be a lifeline, particularly for the young ones and those who battled severe infections before. Now, let's address the elephant in the room, fever. It's not just discomfort, it's a red flag, a potential herald of sepsis. For someone without a spleen, a fever isn't just a fever, it's a call to action, a reason for immediate medical evaluation and treatment. Imagine a scenario where a patient without a spleen starts experiencing a sudden fever, chills, and an overwhelming sense of fatigue. These are the harbingers of a potentially life-threatening condition known as overwhelming post-splenectomy infection, or OPSI. It's a condition that can escalate quickly, leading to septic shock if not addressed promptly. Now, let's pivot to the proactive measures these patients must embrace. Living without a spleen requires vigilance, especially in avoiding infection risks. For instance, traveling to malaria-prone regions without proper prophylaxis is a significant no-no. And let's not forget the importance of being cautious around animals. A simple bite can escalate into a medical emergency for asplenic individuals. Now, you might be wondering, how often do these patients need to seek medical counsel post-splenectomy? Well, let me guide you through the essentials. Initially, it's wise to schedule a visit with a hematologist about 1 to 2 weeks post-discharge. But that's just the beginning. Regular checkups are key, typically every 3 to 6 months, tailored to the patient's unique health needs. And don't forget the annual comprehensive review to keep those vaccinations current and overall health in check. In our microscopic journey, we encounter various red blood cell inclusion bodies unique to asplenic patients. The Howell-Jolly bodies, for example, are like tiny, dark purple signatures within red blood cells, usually ousted by a functioning spleen. Then there are the pocked RBCs, marked by vacuoles that scream hyposplenism to any discerning observer. Astonishingly, up to 80% of red blood cells in asplenic individuals can contain these vacuoles. And let's not overlook the Heinz bodies, those inclusions of denatured hemoglobin that, while less specific, still play a role in our narrative. In the case of a 26-year-old female diagnosed with IDP who is refractory to medical management with prednisolone, a splenectomy is considered. Before proceeding with a splenectomy, certain preoperative preparations are recommended to minimize postoperative complications. Option A, bone marrow irradiation, is not a standard preoperative procedure for IDP patients undergoing splenectomy. This procedure is generally reserved for conditions where bone marrow activity needs to be suppressed or eradicated, such as in the preparation for a bone marrow transplant in cases of leukemia or other hematological malignancies. Option B, pneumococcal vaccine, is indeed the recommended pre-splenectomy vaccination. The spleen plays a crucial role in filtering bacteria from the blood and in mounting an immunological response to certain types of bacteria, particularly encapsulated organisms. Asplenic patients are at increased risk for severe infections, including pneumococcal infections. Therefore, vaccination against pneumococcal bacteria is a critical step in the preoperative management of patients undergoing splenectomy for IDP. Option C, washed leukocytes refer to white blood cells that have been purified by removing plasma, platelets, and other components from a blood sample. Washed leukocyte is not a standard recommendation before splenectomy in IDP patients. This process is typically done to reduce the risk of adverse reactions during transfusions. Option D, platelet transfusion, is generally not recommended as a routine preoperative measure for IDP patients undergoing splenectomy unless the patient has a significantly low platelet count and is at risk of perioperative bleeding. Platelet transfusion is usually reserved for acute bleeding events or when invasive procedures are planned, and there is a high risk of bleeding due to thrombocytopenia. In summary, for a patient with IDP undergoing splenectomy, the recommended preoperative procedure is to administer the pneumococcal vaccine to prevent post-splenectomy infections. Other options such as bone marrow irradiation, washed leukocyte, or routine platelet transfusion are not standard pre-splenectomy measures for IDP patients. As we conclude today's session, remember that the absence of a spleen is not just a surgical afterthought. It's a lifelong commitment to vigilant healthcare, a testament to the resilience of patients and the diligence of medical professionals. Thank you for joining me in this enlightening exploration, and stay tuned for more insights in our next lecture. Don't forget to like, subscribe, and share. Goodbye for now, see you in the next video.